Hi, everyone, and welcome to our virtual discussion today. This discussion is titled Strategies for Rural Health Leaders' Success in a Post-COVID-19 World. We want to thank all of you for joining us. This virtual discussion is being hosted by the American Hospital Association. My name is Sean Berry. I'm a Senior Associate Director here on our communications team. And this is an opportunity to talk about some lessons learned from the pandemic and the vaccine rollout, to hear from leaders both in hospitals as well as on boards of trustees. The AHA is also going to be releasing a playbook that takes some lessons learned from that experience, and also some of the insights that you'll hear in this discussion. And so you'll hear from a variety of perspectives, and we look forward to hearing from you after we hear from those panelists. I'd like to first talk through a few slides to make sure you understand the work that we did at the American Hospital Association on vaccine confidence, so you have some sense of where we were going into this conversation. So if we look at the first slide, we had a few different principles for vaccine confidence. The first was messages that build trust. The second was trusted messengers. And the third was having multiple channels for those messages. Next slide. So messages that build trust. First is ask questions, get the facts, talk to healthcare professionals that you trust. The second is the vaccines are safe. They've been vigorously tested. The vaccines are effective. They're effective at reducing hospitalization, reducing severe illness, and even death. The vaccines help to bring us back to pre-COVID activities, and the vaccines help protect the healthcare workforce that has protected all of us. Next slide. We worked with a number of trusted messengers, and there's two examples that I want to briefly mention to you. The first is our My Why campaign, and this was a series that included voices from throughout the healthcare ecosystem. So we had a mix of C-suite leaders, but we also had environmental services workers, practicing nurses, nurse practitioners, and many others. And we made a very simple request of this group. We asked them to record a short video explaining why they decided to get the vaccine, and to share that video with audiences so they could see people that they worked with, and hear their own voices in the discussion about the vaccine. We also recruited a group of what we called clinical ambassadors, and this was 45 individuals from a mix of clinical and executive leadership backgrounds who we made sure to use their voices in their communities to speak with credibility about issues relating to the vaccine and to the pandemic. So next slide, please. We also used multiple channels to get this message across. So one of those important channels was radio. We had radio interviews with ambassadors, often on public radio stations, to talk about their experience during the pandemic and their experience in the vaccine rollout in particular. We also used a number of digital channels. We actually were able to take radio spots, including paid radio news releases that received guaranteed placement, and then target that even further at the county level using the streaming service Spotify. We also were able to use other digital assets and tools, including some of the MyWhy videos that I mentioned. Print media was also critical to our efforts, and so we were able to place op-ed pieces and letters to the editor, not just in larger daily newspapers, but also smaller community newspapers where we knew we'd reach the people that we really wanted to reach. We had a number of community partnerships through events like this one, as well as through our public service announcements, to make sure we could spread the word as widely as possible. So I think that concludes our slides. I did want to, actually, if we could pull up that last slide real quick. Again, I wanted folks to see on the slide after that, excuse me, just so folks can see what the playbook looks like. So you've seen this image before. We will be releasing this next week. And this is, again, going to build on the conversation today. So we're excited to be sharing that, and excited to kick off the conversation. So that concludes the slide presentation. And I'll just talk briefly about our program for today. So there's really three parts to this. The first panel, as I mentioned, is with a look at the unique role of hospitals and rural hospitals during the pandemic. What were some of the challenges that they faced? Our second panel is going to look at the role of the trustee, and how have board members been partners in the message about the vaccine and vaccine confidence, and what role can they play in charting the path forward? And then we'll save about 15 minutes at the end for questions from the audience. I see they're starting to come in already, and we're looking forward to hearing from you. We'll engage people from both panels in that process, and then we'll conclude the presentation. So to kick off the first panel, I want to welcome my really valued colleague, John Supplett. He's the Senior Director for Field Engagement in Rural Health Services. Great to see you, John.
It's great to be here. Thank you, Sean.
So, John, I know you're going to introduce our panel in a moment, but my first question for you, you've worked with us, of course, on vaccine confidence and on this resource. Could you talk about the value of this resource, how you think it can help some of the hospital leaders you work with, and what are some of the tools in there you think that they might find useful?
Yeah, I'd be glad to, Sean. Thanks very much. I think the Rural Playbook will be of help to our listening audience and to those that are working in rural health services across communities across rural America. I think once you open it up and become familiar with its content and its efforts to build rural hospital leadership, including the boards, it will build around strategic thinking and local problem solving. And I think that's where it really has its greatest asset. In this case, we're talking about COVID-19 vaccine and a related COVID-19 response. But from a broader perspective, you could apply this to emergency disaster preparedness and a response plan to that as well. It just happens to be that a medical surge is the focus of this particular playbook. And the cases that accompany the strategies that offer guidance, innovative solutions, the key resources, the tools to encourage leaders, including our trustees, to think critically about how to approach these solutions, I think all offer some practical advice and resources on how to do that are found within the playbook.
Great. Well, thank you for that. And John, I'm going to ask you to introduce our first panelist, and I know you have some questions for her as well.
Yeah, thanks very much. When you consider this discussion, the success of a hospital, whether it's in good times or in bad, are going to be determined by the culture of the organization and its mission, vision, and values, and how they are lived day to day. And that foundation has to be firmly in place and embraced by the leadership, because it's what drives strategy, especially in these times of uncertainty. And if that foundation is not in place, well, then the leaders will be challenged to lead when they meet with uncertainty. And this playbook will help leaders get to that place where they can develop a strategy and a response when confronted like a crisis like COVID-19 medical surge. And I think that becomes evident when we talk to hospital leaders like my friend and colleague, Ruby Kirby. And I think many of you know Ruby from her work with the Tennessee Hospital Association and the National Rural Health Association. She's now a member of the National Advisory Committee for AHA's Rural Health Services. And Ruby also received the Sterling Award for being one of the top 20 most influential women of West Tennessee. Now, in her day job, Ruby works as a CEO of two critical access hospitals, 25-bed critical access hospitals. One is in Bolivar and the other is in Camden for West Tennessee Healthcare, which is a system located in Jackson, Tennessee. And she began a career in 1979 working at Jackson Madison County General Hospital as a staff registered nurse on the general surgery unit, which eventually led to her position of director of general surgery and the surgical intensive care unit. Then in 2000, Ruby accepted the position as director of nursing at Bolivar, where she transitioned to CEO in 2003. So Ruby, I suppose all that keeps you pretty busy.
Not really, because I have a wonderful group of people I work with in both of these hospitals that take on a lot of responsibility of taking care of our community. So it's really an enjoyable job for me.
Well, and you have the resources of West Tennessee Healthcare as well.
Too.
So Ruby, when we drill down on this conversation about COVID-19, we all know that many rural counties have vaccination rates that are below the national average. Can you talk to us and share some of the challenges you may have faced in Bolivar and Camden as you were rolling out the vaccine?
The major challenges we had at first is we did not know enough about the vaccine, or our community did not know enough about it. And just originally getting out the education on what the vaccines, were, which ones were available, where they could get them, answering any questions that our citizens had. and putting together a coalition that could actually go out into the rural communities to make sure that we made the vaccines available to those that wanted the vaccines. In small hospitals, a lot of us were not able to accept the vaccines because the first one, Pfizer, had to be stored at a certain temperature. So we worked in partnership with West Tennessee Healthcare, who was receiving the vaccines from the government and the state. And number one, we had to figure out how to transport them to our locations, um, which, we had everybody that was able to transport. After we got the containers to transport them from the C-suite to whoever could move that day. And then we were fortunate in both our small rural communities. We already had health councils working in our areas that was made up of faith-based health departments, other healthcare providers, coordinated school health. And those individuals, a lot of them was able to help us, and we helped them get the vaccine out and administer the vaccine. And we learned quickly we could not depend on them, people coming to us for it. We had to be able to move it out to the community. So our leadership, our mayors, they had ways to bring people in as far as getting the vaccine, set up transportation, because that's always a major issue in our communities is transportation. So on weekends, they would use the school buses to transport people in from different parts of the county. So those were some of our biggest issues, of getting it, of course, and just being able to go to the community to meet with different groups that, provide answers when they had questions.
And it's funny, we have to take ourselves back 13 months
Mhm.
when this conversation started, when the vaccines were available. And as you pointed out, it's I don't know if we suppress our memory, but it's easy to forget how challenging it was to get access to these vaccines. And as you pointed out, to get the supply transported under very tight conditions to your community so that you could then begin to distribute them.
Yes.
And that's a long time ago when you think about it. Um, how successful were you in those, at least in those early days, in getting get that vaccine out to folks and getting the jabs in people's arms?
We were, fairly successful. We still have a long way to go. Overall, still in both of these communities, our vaccination rate is a little bit over 50%. We're just at 50%, and that's for the adults. Children is an area that we have a long way to go. We're still spending a lot of time trying to educate the community on the pediatric vaccinations and side effects. So that is still a challenge, and we are still addressing it every day.
So let's take a look at that and talk about the message versus the messenger. And you had said that you got West Tennessee Healthcare help you with the logistics to get the vaccine out to the communities. But then you were saying how you were working with the health council and faith-based leadership, which aren't necessarily members of the hospital board, but members of the community with whom you had relationships. Tell us about how you built those relationships.
Actually, we have had the health council in existence here for about 15 years. We started addressing other health issues such as obesity, diabetes, COPD, um, infant mortality. So when we composed the health council, we knew we could not just look at the medical side of it. So we had to include the schools. We needed to include faith based churches because of who they serve. We got social organizations like the NAACP and, Black History Coordination. We got other like we have a school health clinic. We bought them in our FQAC. other healthcare provider, as well as governance from the mayor's office. We had people coming in from everywhere, and we have traditionally worked on projects together. So that was a blessing for us that we already had this format in place. And when we first started talking about COVID, we were still able to meet in person, and we shared a lot of statistics with them. So when the rubber met the road, we knew who we could call on to help us with this project.
Yeah, so these were relationships that you had built up for 15 years and that you had really good connections with. And it might have been somewhat different in Camden though, because you became CEO of that critical access hospital about a year ago.
Yes, it did, even though they had a health council and I had actually had a little contact with them. Um, but they still had the county health department that they were working with. EMS service up there worked a lot with the vaccine distribution. And then the hospital took on a lot of responsibility. And then I was able to, once I was there, speak for both hospitals and do a lot of education, not as much as I had in Hardeman County. Um, but we also always had West Tennessee Healthcare and their resources to go out in both of these communities to help us.
Mhm. Well, and when we talk about the messenger versus the message, I mean, the message was clear, but in terms of your ability to reach out and educate and inform and create awareness, it seems like the messenger was pivotal to your success.
I think the messenger is the most important. You have to have somebody just trusted by that community. That was the reason why a lot of the faith base in churches were really important to us to get them included. Schools, because when it came to getting some of the initial pediatrics were the coaches that could explain to their teams what was going on, the importance of them getting the vaccines, um, and then anyone else, um, your mayors, our state representative did work with us and radio ads and gave us time on their radio stations, and so those were people that was trusted in the community, and some of them was, you know, if they said it, then a lot of the community believed them.
Yeah.
And another group of people I can't leave out is nurses and individuals that work in the hospital. So you always have these nurses and respiratory therapists that work in your hospital. Patients have seen them over the years and know them. And when you got those individuals out talking to the community, they were very trusted also, as well as the providers that worked in the community.
So it's great to hear. So you overwhelm the community with love and information, and we're able to succeed. So what's next then, Ruby? What's next for your hospitals in Bolivar and Camden?
We are really working on trying to get our pediatric population vaccinated. That is low volume. And even though their parents may trust us when it comes to their bodies, it's a lot more difficult to get a parent to really just turn their child loose. And a lot of them are waiting to see what's going to happen. And fortunately, our children have not been ending up in the hospitals with the last variants. Uh, and we are still educating a lot with the children in both communities and working with the schools. Um, like I said, we have a school health clinic that is in Hardeman County School that they're working a lot with the parents. And actually, when we go back in the fall, we're helping the Benton County school system to have a school health clinic there. That they will have a nurse and a nurse practitioner on campus that can help us with the education with the parents and um, actually can give the vaccines if they request them.
That's great. Well, listen, thank you very much for sharing your story with us. And these are the kinds of stories that you can anticipate hearing more of when you see the playbook. There's a number of case studies that are there. And of course, Ruby brings tremendous amount of experience to the communities that she served, both as a clinical professional and now as a experienced and seasoned administrator. And so we expect nothing else than success as you go forward. And we want to wish you all the best of luck. So thanks very much, Ruby. And Sean, I'll throw it back to you.
Great. No, thank you both very much, John and Ruby. It's been really great to work with you over this past year and a half. And Ruby, really appreciate your perspective. We'll bring you back at the end for any audience questions. And thank you, John. We'll bring you back as well. And I'd now like to bring in my colleague, Sue Ellen Wagner. Sue Ellen is our Vice President for Trustee Strategy and Engagement, also a really critical partner in this work, particularly as we have over the past few months looked at not just engaging C-suite leadership and clinical leadership, but also trustees. And she leads our strategy at the AHA for engaging that really important audience, making sure they know the resources we have available, and also making sure we're hearing from them about their needs and how we can support them. So Sue Ellen, thank you so much for joining and being a part of this discussion. I want to ask you a similar question to John, but with the trustee perspective in mind. What do you think will be of value in this resource that we're putting out? How do you think it can be useful in the field?
Thanks, Sean, and it's great to be part of the program today. This playbook is going to be very valuable to board members. Board members are our business and community leaders, and they're also trusted messengers. I liked how Ruby talked about the trusted messengers being very important, and trustees are trusted messengers. So I think arming them with key strategies and information that they can share with their communities to build that level of trust will be really important as we move forward.
Great. Well, thank you for that. And I know you have a couple panelists to introduce, so I will hand it off to you to bring in our second group.
Great. Thanks, Sean. And it is my pleasure to introduce our next two trustee panelists, Michael Charlton and Betty Greer. Michael Charlton is chair of the Board of Trustees for Atlantic Care Health System, and he's also president and CEO of Icon Hospitality. Michael founded Icon Hospitality, which is the parent organization for several subsidiary businesses in the southeastern New Jersey area. And Michael is also a member of the AHA Board of Trustees. So welcome, Michael. Our next panelist, Betty Greer, happy to have you with us as well. Betty is chair of the Board of Trustees for Kearney County Hospital, which is a critical access hospital serving a 10-county rural area in southwest Kansas. She is owner-operator of Greer Consulting, which provides school finance and genealogy research. She is also a member of a small hospital trustee director for the Kansas Hospital Association. So welcome to both of you. And Michael, I think I'll start my first question with you. How have you approached your role as a trustee during the pandemic?
So first, I want to thank you, Sue Ellen, and very excited to be here today. So I think what the primary thing that to focus on during the pandemic is how the role of the board trustee changed. So prior to that, obviously, we have, our primary roles and responsibilities are obviously our duty of care and our fiduciary responsibility to the system. But, March 16th, 2020, all that changed and the world changed. And I think as the 24 months have passed, the role of the trustee during those times has also changed in the sense that you really went from a fiduciary role of understanding and monitoring the strategic initiatives of the organization, but then you really had to embrace the advocacy roles. I really have to applaud and commend Ruby on some of the things that she discussed around trust, around community, around those things. And she really hit it spot on. And I think that was with a real pivot of what our board of trustees did. We really became advocates for the organization and bringing out the messaging around the community because it was an incredibly difficult time. The system was involved in the day-to-day work and trying to maintain everything that was going on. So the board really took the role of communicating the message out to the community at large.
And Betty, how about you? How did your role as a trustee play out during the pandemic?
It was an interesting role, and I thank you too, Sue Ellen, for including Kearney County Hospital in this presentation. anytime we have a chance to talk about our local avenues, we always like that opportunity. So thanks. But our board immediately became the support group for our providers and our staff. There isn't a question. In the beginning, initially, we agreed totally that the same rules that would be enforced for our staff would also be the rules that the board would adhere to. Our medical staff led us in commitment with their direction to the community, in presenting to the community. We as a board and staff were grasping at any information we could learn, although when the rules were continually changing, it was tough to stay in tune with what was going on. Our role as the board was to support staff and work to keep our facility in good light and open.
Great, thank you. Moving on to the next question. And Betty, let me start with you for this one. How did your role change when the vaccines became available?
When the vaccine came out, what we saw in our community was the division and lack of empathy. The community was split. They knew how the medical group stood, including the board. We communicated to the community the need for the vaccine that would help keep the community safe. That was our message. We needed to respect the wishes of others' opinions. Good collaboration together from the health department and emergency health services and other groups made that possible. Most of our challenges we dealt with were from other organizations that were not in the same mind. They were not medical field, so therefore they did not feel like they needed to abide by any of the rules, which then of course added additional problems in the hospital level because that's where they wound up at.
Thank you. And Michael, how about you? How did your role change when the vaccine became available?
So very similar to Betty. When the vaccine rolled out, obviously we understand on a macro level and a national level all the controversy that was swirling. So it really became the determination of the board to make sure that we had alignment with senior leadership, with the clinical staff, and that we had talked through all those challenges that were so broadly being broadcast across the country, and making sure when we walked out of that boardroom that we were one face, one page. So, and then once that was decided on what direction we were going to take, the board's role was really to amplify that message and then to demonstrate the behaviors that we were expecting, and then to roll those behaviors out through the community, and take it one group at a time. And I think to date, we're pretty effective. In our county, in our primary service area, about 79.5% of our population has at least received one dose, and about 66% to date, I believe it was as of yesterday, is fully vaccinated. So we're pretty proud of the messaging and the work that we did around that.
Great, thank you. And you both have been critical messengers. So that goes back to the question that I answered about the Board of Trustees being critical messengers out there to their communities. So thank you both. Michael, I'm gonna stick with you for this question. Where do you think trustees were able to add the most value in all of this discussion with vaccinations through COVID?
Sue Ellen, I would have to say it's definitely in the messaging, and it's definitely, as Ruby said, it's definitely about trust. So, on these boards, you have so many community members that are so deeply involved in different segments of the population. And I think that's where the real value add was. You can make judgments, about the coherence and the validity of the message, right? But you're also making judgments on who is delivering the message. And I think that's where the community members that serve these boards really had the biggest impact. They were people that were trusted within the communities, trusted in the social groups that they encompassed, and they were able to move the needle. So I think that's where the real value add came.
Great. And Betty, how about you? What type of value were you able to add in your fellow board members?
Not only interaction in the community and meeting with people, but supporting our staff. That was vital. We needed to let our staff know that we were behind them 100%, that we were willing to do anything we could to help make their job easier, to get through this process until we were maybe where we are today. and we're still supporting staff. That had such a good review, and that helped our culture so much to bring our board and show that our board actually cared about what was going on, that made such a huge difference to our staff.
Thank you. Last question. I'm actually going to ask the same question that John asked of Ruby to each of you. What are your thoughts on the message versus the messenger when it comes to the vaccine? We talked a little bit about that, but Michael, can you add any more detail?
Well, Sue Ellen, I think it varies depending on what the message is, but in this particular case, when it came around the vaccine, there was so much controversy and there was so many politics tied to it, right? So, I think the points that Sean opened up with, the safety of the vaccine, the efficacy of the vaccine, protecting our clinical staff, protecting our patients, protecting our community, they were relevant messages. And, as I stated before, that no matter what the validity of the message is, the messenger is critically important. So I think that's really the key when you're looking at who the messenger was. It's, do they have the relevant experience and expertise? Are they trustworthy? I think they're all things that weigh out when delivering this. And I think when you combine all those elements, it becomes far more effective. So I think the messenger is critical in this particular case.
Betty?
Our chief medical officer and the emergency prepared officer were the primary public newspaper articles, video type things out to our public. And our emergency prepared officer is the one that led it. There was a lot of discrepancy going on. The community didn't have full support of him. So when our medical officer stepped in and they unitedly did it together, then that trust was built back, and that reassurance that everything, yes, is what the medical field needs to promote to and make the best effort for. So our community. So yeah, it was an interesting concept because one person had that ability to project that and the other one was struggling. So the two of them combined, it made it work, and it built the trust back in the community.
Great, thank you. Sean, I'm going to turn things back over to you.
Great, thank you so much, Sue Ellen, and thank you, Michael and Betty. And if you all could stay where you are, we're going to bring our other panelists back, John and Ruby. And so now we have time for questions. We're a bit ahead of schedule, which is great because we did get a few pre-submitted questions, and I want to remind audience members you're welcome to put your questions in the chat if there's something on your mind or something that you heard from a speaker that you'd like to hear more about. So I'm going to start with some of the pre-submitted questions, and I really appreciate folks who took the time to submit those. One is something I think I can address, which has to do with the playbook itself. And there's a question about whether anyone conducted an after-action review about presumably either pandemic preparedness or the vaccine rollout. What's the format for that document? So it's a great question, and one of the things we're trying to do in this resource is really to provide some tools for hospitals and health systems, particularly rural hospitals and health systems, to look at how they conducted their operations and their vaccine education work, and see how they might replicate that during a future public health challenge. And so we have a section in the playbook on assessments that allows for that facility or that board or whatever entity might be interested to basically take an assessment and sort of look at some of those factors. And so definitely something to look out for in that resource. Another question we received, and Ruby, thought you might want to weigh in on this, and this obviously came up a bit in your conversation with John. And the question was, how does a healthcare provider promote vaccination in a community that may not believe vaccinations are necessarily important to managing the coronavirus? So Ruby, do you want to weigh in on that a little?
That is difficult, but I think sometimes when people see the educator or other individuals talking about why they got vaccinated, so we would use a lot of the frontline staff or people that were on the front line that would talk about why they got vaccinated to help protect the community, to protect their families, because healthcare workers were afraid to go home at night a lot of times, thinking they would infect their children and their spouse. And then we would just be honest with why, we thought vaccinations were important. And the other thing that we also talked a lot about, if you remember how full the hospitals were, and in small community hospitals, we would let people know that, when you came in extremely ill, how much difficulty we were having to place you or transfer you out of these small rural hospitals. So I do think that got a lot of people's attention. And, we had some prominent community, some people in our community that had COVID, and they also would go out and share their stories and talk about why they were going to get vaccinated. So it was an all hands on deck type planning as far as telling people why vaccines were important.
Thanks, Rubino. Appreciate that answer. And it kind of goes back to, I mentioned in our opening presentation, some of the radio news releases that we did at the AHA, and Ruby was one of our partners in recording one of those pieces. And one of the messages that we incorporated in that spot, starting in January, particularly about holiday travel, and this was during one of the surges, of course, where you did see our AHA membership really be at capacity in many parts of the country. We did start to talk more about not just protecting yourself, your family, your community, but also that the healthcare workforce, the people that have taken care of you, and the ability of hospitals and health systems to take care of you, that's part of this public health response, part of what vaccination is about. So something that didn't come up as much in the early days, but certainly something that we added on to. Another question we received, this was a pre-submitted question also, and the question was, how are hospitals using digital strategies as part of their vaccine outreach? And Betty, you and I were talking, and I was interested to learn. I didn't know when we first met that you were also on the Kansas Hospital Association board. I know that they've been active somewhat in this area, so curious about some of the work they did, and obviously you're in one part of the state, but they're reflecting the entire state. So hoping you could talk a little bit more about that.
Sure. Yes, the Kansas Hospital Association has put together a workforce strategy initiative that includes work with organizations such as the Board of Regents and the community college trustees to develop tools to attract students to programs, educate guidance counselors on top healthcare careers, scholarships, and tuition forgiveness, work with regulatory boards to promote policies that value quality while reducing barriers to career fields, create inventory of current healthcare training opportunities, facilitate the development of community sustainable stakeholder groups such as Chamber of Commerce, Farm Bureau, bankers. These are all vital pieces that help us, and there's many more pieces to go with this, but I'm just highlighting basically the pieces of it. But also support legislative regulations that allow hospitals to develop childcare programs more easily for employees, and work with regulatory boards to promote policies that value quality while reducing barriers. So yeah, Kansas Hospital Association has done a great job in putting this initiative together, and it's a work in progress.
Got it. Yeah, you actually anticipated. I was hoping you talked a bit about digital strategies, but we got a bunch of questions about workforce too. So I really appreciate you addressing that. And as Ruby just did, it's hard to decouple that from the rest of this work. So thank you for that. I'm going to look at some questions that came in through the chat. So one was just about the opening slides, if those are available. Happy to share those. Also want to mention we have a number of resources on the AHA website. That's aha.org/vaccine confidence. You can also Google AHA vaccine confidence. And this has a number of the resources that we've put together through our grant with the CDC. This was a 2-part grant. So some of the videos that I talked about, the My Why videos, we do have some information there about the work with clinical ambassadors that I mentioned in terms of radio spots and earned media interviews. So I'm definitely encourage you to look at that. It's a continued work in progress, continuing to add new content there, but a lot of really good resources there for folks to look at. I do have another question that came in, and Ruby, this was directed at you. So the questioner said, "Great to see you." So you talked a bit about community education, and this questioner was interested in to what extent your hospitals or West Tennessee Healthcare looked at social determinants of health. I'm sure that's a regular part of your work, but perhaps in the pandemic and vaccine context. So there's a mention here of food insecurity, high occupancy housing issues, other health conditions that may be chronic, that may affect some of the community members you're trying to reach. So I know there's a lot there, but hoping you could speak a bit to that.
Social determinants of health is involved in most everything we do. Actually, we have in Hardeman County, especially, we had already done a lot of work around this issue, uh, working on a grant with the CDC and the University of Tennessee at Knoxville to address our obesity, inactivity in our county. And when you start looking at obesity, of course, you look at food insecurity. We're going to look at other compromising health condition, high blood pressure, diabetes, COPD, and we know the community. We know a lot about our community from that work. We pretty well knew which area our population was going to come from that was having food insecurity, and we had started addressing some of that. We knew where we were going to get people with high occupancy in housing, and we start working on plans and how to educate them on how to isolate in homes, and if at all possible to move out those individuals into other family homes that had compromising health conditions. um, so we did a lot of work around that. uh, you know, early in the pandemic, or we started using remote patient monitoring, so we could, families felt better if their family members were having to stay alone, if they knew that they had remote patient monitoring. So, that helped us a lot as far as getting patients out of the homes. And then, like I said, a lot of times when you got one or two in the families that we could get vaccinated, a lot of them would bring the rest of the family members, and they would talk about, how if they didn't, they couldn't see mama or grandmama or whatever. So we always looked at the social determinants of health, thank goodness, because we knew where a lot of these individuals going to come from with these complications.
Right. No, thank you for that. And one more question for you, and this had come up in a previous conversation we had with the two communities that you serve. Maybe there's a two-part question. First being you received your appointment to lead Camden Hospital. More recently, you've been leading Bolivar Hospital. I'm curious about some of the differences between those two communities, and how you had to have perhaps a different strategy or approach around the vaccine in some cases because of that. And then related to that, I'd also heard you speak to, because you're serving some smaller communities and you have a lot of staff that have been with you for a long time that really are part of the community. We sometimes talk about community and workforce as sort of two separate categories, but I've heard you say you really can't do that with your hospitals because the patients know the nurses, know the workforce, and vice versa. So was interested in your thoughts on some of that.
Um, the two communities I serve in, if you look at the social determinants and race, Hardeman County is about 45% African American, 50% Caucasian, and we have about 5% others, primarily Hispanic. Um, Benton County is totally opposite. The reflection of that community is about 90% Caucasian, 10% African American, and others. So I find that when it comes to vaccination hesitance, though, it doesn't matter because um, it, they have different reasons for it, but it just is a matter of trying to educate them on what their beliefs are and what the actual facts, surrounding the vaccine. Hardeman County, we spend a lot of time with our African American community because of, history, and the young people had ideas that, if they got this vaccine, law enforcement and everybody was going to be able to track them, and so you address it from their concerns. When I'm in Benton County, you address the concerns and the misinformation and everything that surrounds the vaccine is no good, is causing these complications. So, as far as the community is concerned, they have a reason for why they don't trust the vaccine. And what I've found, you just have to answer it based on the community and the people you're talking to and give them, the actual facts, no matter what. Um, and the second part, I think you were asking me about workforce, Sean.
Yeah, I think I was just asking you in terms of your communication with your workforce in the community. I'd heard you comment just that because you have a lot of longtime employees that are just very close to the community, that just the sort of community workforce distinction is just very fluid. And so I was just curious about sort of that dynamic and those relationships
Um,
with patients.
a lot of now, I'm fortunate that a lot of my workforce in both facilities are long term, and the physician. And when you get those individuals on as champions that are in the community, it may not even be a formal meeting or church. They can informally educate a lot of people in the community while they're working in the community or visiting or whatever. So, the main thing that we found is that we had to get the education for us and know that what we were trying to provide was factual information, not going outside the box and trying to make it sound better, but just actually giving them the correct information as best as we knew it. And sometimes it changed, and we would admit that as we went along and we learned more about the vaccines, circumstances changed. So, but when you got long term employees and people that they know in the community, it does tend to help in both communities.
Great, thank you for that. And we do have a few more minutes, so if folks have other questions, please don't hesitate to share those. We'd love to take additional questions. I did want to bring Michael in and see if you wanted to speak to any aspect of social determinants of health, or just from the perspective of someone who is a community member who runs a business and sort of sees how hospitals fit into that. Would you want to speak at all about sort of the other factors that might influence health and how you think about that as a trustee?
Absolutely, Sean. I think if COVID proved anything, it proved how incredibly important the social determinants of health are, right? And, I also feel that you probably could add, besides food insecurity and some of the other things that have been mentioned, you could probably also add the connectivity issues that we have, because obviously telehealth and telemonitoring, all those things came so incredibly important during COVID. But, there's no doubt that the social determinants of health, some of our underserved communities, food insecurity, access, all these things, that is the future of what we have to do. The question is, how does all that work get done? With everything that goes inside the four walls of the health system, I think the realization has come that, the work that transpires outside of the health system, outside of our four walls, is just as important. So, I think it's a work in progress. I think a lot of great leaders, great health systems are trying to tackle this, but it's definitely the direction that all health systems are going to have to move. We have to get further upstream to solve some of these problems.
Right. Well, thank you for that answer. And I don't see any more questions coming in. So I think that's a great note to end on. And I do want to, again, mention our playbook that's coming out. We'll certainly be sharing that with people who signed up to view this program today, as I mentioned, sometime next week. And want to, again, thank my colleagues, Sue Ellen and John, for your partnership in leading this discussion. Want to thank Betty and Ruby and Michael for being so generous with your time to answer these questions, share your perspective. I think this was a really enriching conversation. We will also be, this is recorded, of course, and so we'll be sharing this recording. If you have colleagues or others that you think might be interested, we'll be able to share that very soon. So want to thank everyone again for joining and have a great day.